In the year to June 2017, figures from NHS Digital show a drop in the number of GP practices. 202 practices in England have closed or merged, with most closures, 64, located in the north of England. At a time of GP shortages, NHS Trusts and the Clinical Commissioning Group in North Cumbria have been using innovative new ways to recruit and develop a workforce that will meet the county's needs. Jonathan Gibson sent us this.
Cumbria's rich and varied landscape attracts visitors from around the world, but it's also a challenging terrain for delivering NHS services, which is why offering interesting training opportunities is seen as the key to future sustainable recruitment. What are some of the challenges of delivering healthcare in these rural communities?
I think, well, we're experiencing one right now, really. The roads are like this in a lot of the county, and we have teams spread out over different locations. Because we can't be focused upon a main hospital site, we have to think differently and develop things and be innovative in our approach.
So how can I help you today?
Italian GP Rosina has relocated to Cumbria as part of an international GP programme. As part of her training here, she's doing a placement at this sexual health clinic in Carlisle. As well as treating patients, she's receiving on-the-job training with the aim of securing a full-time post as a Cumbrian GP.
What we're going to do is just go through the GP curriculum as applies to sexual health.
These bespoke system-wide placements are unique to Cumbria.
This training works very, very well because I had the opportunity to get new medical skills and to start working while I'm studying.
Cumbria has difficulties in delivering healthcare, so by attracting external people to see how we do things, they're seeing just how nice it is here and to settle here and to participate in our healthcare provision.
But the International GP programme is just one of the initiatives being used by the NHS here in Cumbria. GP integrated training is one of the others.
So he's on some Zomorph for his pain.
At West Cumberland Hospital in Whitehaven, Australian Dr Jocelyn is developing a special interest in palliative care as part of her GP training.
It meant that when we have patients in the community hospital that we're responsible for as well, a lot of those have palliative care needs, so this training translates into that.
According to Jocelyn's supervisor, herself a consultant in palliative care, schemes like GP integrated training are helping to keep services sustainable.
We've actually advertised for probably over a year at different times for another doctor to join our team unsuccessfully at specialty doctor grade. So having an opportunity like having the GP with a special interest means that we are sort of growing our own workforce for the future.
I've brought Alex, one of the students, to see you.
In one of Cumbria's accident and emergency departments, Alex is also in training. The Trust has adopted an American model to create a new position known as a physician associate.
They are not doctors, they're not nurses, they are their own unique qualification, and the idea is that they work alongside doctors and they always have a supervisor. So this is a formal partnership between the University of Central Lancashire and our North Cumbria University Hospital Trust and the Partnership Trust.
It's been brilliant, it's innovative, it's very fast-paced, and it's been a great challenge for me.
It's another example of the NHS in Cumbria thinking differently to recruit staff and make services sustainable to serve its local communities.
We have to look quite smartly at what our services do, the challenges they have, but you've always got to have one eye on the long game. So it's about delivering on what we have to do in the short to medium term, but what are we doing to build up the sustainability of our services, you know, as all of us become older and all of us have health problems. So part of the good performance and innovation cross-sectionally is building up a more sustainable system as the system matures.
Not just sustainable, but fit for purpose, using innovative thinking to encourage trainees to come to the county and drive positive change.